Hello, this is Heinz again, and we are now showing the demonstration. First of all, let me just quickly show you what we are using. This little device, which you can see here, is what we are using for the identification purpose. In later the application, this part can be or will be used to apply to the fingernail, for example, of the user. So I will now run you through some of the applications which show the possibilities, not by far all possibilities, we have realized so far. And I want to start with the possibilities, some possibilities, how to use it in a hospital. So let me start. So first of all, what we put specific attention to is to make it user-friendly, because we have the position that the doctors, the people in the hospital, they should not have to focus on how to operate the thing, but they should be able to focus on their key job, which is doing healthcare, serving the patients. Let me show you the example right now. We've used what we can do, what the doctor can do. So the doctor can just open the menu, and I've associated this particular tag with one patient. So, for example, the doctor can, while he is in the hospital, at the patient in the room, he can scan the nail of the patient, and immediately, based on this information, this unique combination of the nail, he can immediately see the personal details of the patient. So that's one example. We can go also with another example for the same patient. Not only written details, but you can actually go further ahead. For example, in this case, we have linked an MRT scan for this patient. This is actually the knee. So the doctor can actually online in the room, when he's making his visits to the patient, without having to carry all kinds of documents along, which might be outdated, so you can immediately see what is the latest status, and it's 100% guaranteed that there is no chance that the documents get mixed up, so that the documents and the patient he's talking to doesn't match. So I'll show you with a different, you can see here, with a different patient, show you the same thing. So go to the patient again. This is the fully detailed an example. I simply scan it, and as you can see, now here you have a different patient, the patient which is associated or directly linked to this particular tag. Some very important information can be put down here. For example, if the patient has some allergies, what was the latest diagnosis, which kind of treatment has been undertaken, which kind of treatment is planned, and so on and so forth. Also the same thing, and you see it's very convenient and very easy to handle. Same story. In this case, it's a different MRT scan, which is again linked to this specific patient, so that it's completely impossible that there's a mix-up of the information between information and patient. Let me show you that how it can also work. This card here is a patient, is not associated to a patient. So if for any reason this happens, and the doctor wants to scan that and wants to look at it, he will immediately get the information or the message, there is no data for this patient available. So again, it's not only making sure that the right data are associated with the right person, it's also guaranteed that that if there is a person is not registered, that this information is shown. So again, there's no risk of any confusion, of any errors. So that's the purpose, or that's the function for the doctors. Obviously, we can implement a different submenu, which is for the nurses, who will have access to different data of the patient. Some data is restricted to the doctor only. Some other data will not be interesting for the doctor, but for the nurses. And a similar thing for the administration. And by the way, the programming of this chip is very easy. Once the patient enters the hospital, his data are whether already in the system or are programmed in. The chip is programmed, put on the patient's nail, and that's it. And the very moment you remove this nail from the patient, the nail is destroyed. Means you cannot. It's also a fail-safe protection or fraud protection. If somebody intentionally or unintentionally removes this tag from the nail, it's guaranteed that it cannot be applied, or